So we're going to talk about pulmonary embolism. Okay, so this is a cartoon that I got from this website. Okay, this is a good website that you can click on to have a look at the microscopic and the gross picture. So this is a cartoon of it that I got from that space. So it shows that the movement from the DVT and the deep vein thrombosis in the leg, it moves up to the heart. So we've discussed this in the lecture. Okay, and so this is the cross section. Okay, you got a big, the lung is being resected. So there's obviously there is a big blood clot here in the blood vessels. Okay, there's another blood clot here. And you can see here the color of the lung also is a bit pale, and the one in the bottom here, the lower lobe, looks a bit congested. So is the can you see the cursor now? It turned red on its own. Okay, so this is the picture of what we call saddle embolism. Okay, saddle embolism is the one that is circled in blue. Okay, so that's the blood clot. So this is a fresh lung from postmortem. So obviously, saddle embolism is a very big emboli that goes into the main trunk of the pulmonary vessels. So it bridge between where the pulmonary artery divides into the right and left main pulmonary artery. So patient present with sudden death in this case, and there's patient with saddle saddle arteries. Okay, and saddle emboli can cause sudden death. Okay, but medium size. So medium size thromboemboli will block some pulmonary artery. Okay, and then it will produce a lesion called here hemorrhagic infarct. Okay, why it is called hemorrhagic infarct or red infarct, and it's always a wave shape because the pulmonary artery carry most of the blood oxygen is cut off, but the bronchial arteries from the systemic circulation, okay, supply about 1% of the blood to the lung is still working. So that's why you got hemorrhagic infarct. So there's only two organs that have this kind of changes when they have infarct. So you need look out which is the other organ. Okay, so there's another picture of it, right? And okay, the blood in the blue circle are the infarcted area, so it's very pale, and the one in the bottom here is the hemorrhagic infarct. So there's a bit of hemorrhage in the bottom. So there's another picture here that shows the blood clot. So there's a blood clot here. So this is a close-up of a thrombi in the main artery of the lung. Say it's in the red circles. So you can see on the right side is the fresh clot, and the one in the middle and the one in the left, that is the more old clot that has been organized and has become a bit fibrotic. And obviously you can observe here that the thrombus fill up. Okay, the emboli fill up the lumen 100%. So this is a case of sudden death in PE. Okay, okay, so this is a picture of it. So you got a cross section from the one that we saw just now. Okay, the one in the left here is the normal looking alveoli. Okay, and you got the blood vessel wall. Okay, the one in the center, the blood vessel wall. And the rightmost is the blood clot. Okay, this is the whole thing is the thromboembolism. And you can see here some reddish, this is congested blood vessels. Okay, so this is another picture of it. So this time you just section it through longitudinal section of the artery. So at the periphery, those are the congested lung tissue. And then this is the thick blood vessel, and there is blood clot or hematoma in the center. Okay, and you can see there's a pinkish area there. So this, the pinkish area in the blood clot, those are the area that is a bit old. Okay, and the one that is bright red are the new clots that has been formed. And you can see, I remember from your thrombosis lecture, lines of Zen. Okay, so this is what you call line of Zen. So there's pink and the dark, the darker red area. Right, so this is a more organized thrombus. And you can see here, there's a recanalization. So this is an old thrombus, probably in the medium or small size of the artery. Okay, so eventually when this occurs, if the emboli does not resolve, so it will become, it will reorganize itself and somehow we form a small lumen to allow the blood to flow through it. Okay, and with this kind of diameter of the lumen, it will increase pressure in here, so patient will have complication of pulmonary hypertension. Right, so this is one of the complications from chronic pulmonary edema, pulmonary embolism. Sorry. All right, so this is a microscopic picture of it, of a different cause of pulmonary embolism. So we've learned that not only just blood clot that can embolize to the lung. So the one you see here, this is the alveolar wall, alveolar space, and within the alveolar wall here, okay, you can see here there is a clear area. I hope you can see with this red cursor. It's changed color by itself. Okay, and this is fat. Okay, so this is fat emboli that usually occurs in patients who had trauma in the legs. Okay, patient do survive if the emboli is small, but if it's very big, the in our bone, okay, there is a fat tissue and as well as bone marrow. Okay, the cellular component. So this fat become dislodged from the marrow component because of the trauma, and it travels up to in the blood vessels and end up in the lung. So this, if they are very small, so this is what happened in the patient's lung. So I assume this is a post-mortem from, or probably a biopsy, a lobular resection from a patient. And this is a case of amniotic fluid embolism. So you can see in the center, the purplish line in the center, these are what we call fetal squames. Okay, and this is one of the cause that a mother after delivery, post-delivery, suddenly become unconscious and ended up in ICU, and if unfortunate enough, she will die. So this is one of the complications from delivery after the pregnancy itself. It happens, but in very low incidence. Okay, many women survive delivery. Don't be scared, ladies.